Hello and welcome to my channel. My name is Peter Abraham. I'm a second career registered nurse focused mainly in advanced illnesses that would qualify for either palliative care or hospice care. Those are two separate services. I'm also a certified end of life doula through the International Dual Life Movement, a end of life and healthcare educator. If you're new to this channel, welcome. Thank you so much for taking the time to visit. In this channel, we talk about issues related to death and dying. After all, we are all going to die. No one is making out of this world any other way, unless you're here for the rapture. That's a video for a different time. I like educating people on what to expect. So in this channel, we'll have videos for my fellow hospice and palliative care nurses, my fellow holistic nurses, my fellow end-of-life care professionals, including end-of-life doulas, as well as caregivers and family members. The topic for today's video is going to be for my end-of-life doulas, death doulas, and other community educators. Get out there in your community. And before I go into today's topic, I do want to take a moment and ask you, what are you grateful for? I strongly believe that if we work every day without taking a day off on this issue, every day on building resilience, to me, there are three pillars. We work on the third one in this channel, indirectly in terms of taking a moment. Gratitude. What are you grateful for? You build up resilience when storms happen in your life, when grief happens in your life, loss happens in your life. You will still have valid feelings. All feelings are valid, but you're less likely to stay on the floor, hugging the floor with those feelings. You're more likely to stand up and say, I'm ready for the next moment if you have resilience. So, what are you grateful for? Please feel free to comment below. This is a non-judgmental channel, but you don't have to. As for me, I'm grateful for what we're going to be talking about today. I'm grateful that because I was networking out there in the community, on Friday, September 12th, I went to a health fair. I didn't know about it in enough advance warning in order for me to get a table there, but I did put in another video that you may have seen if you're paying attention to this channel. And before I go too far, if these are topics and issues that are of interest to you, please consider subscribing, hitting the bell notifications so you're notified of new videos, and like the video. It helps small channels like mine. But on Friday, September 12th, I went to a healthcare fair at the Madison County Library in Richmond, Kentucky. I didn't know about it enough to get a table, but I'm glad in this time that I went and walked and I got to meet 12 out of the 13 people there. The one person I didn't get to meet, I did leave my card. She had to step away, but it was a wonderful event. And because of that, we have what you're seeing here, the Telford YMCA, who was one of the participants in that healthcare fair. They reached out to me and said, would I like to have a free table where all I have to do, I have to show up at 7:30 in the morning. It starts at 8. Show up, I bring a tablecloth and whatever promotional material, and if I'm comfortable wearing a costume, they'd like to see me in costume. I'm still thinking about that part. But here's an opportunity. When I double check with them, they sent this out Monday. I wrote them an email back on Monday afternoon after doing some thinking about it. You know, how many people, how many vendors do they have signed up? They wrote back, they already have 16 plus. So we're heading towards 20 vendors, and that this is going to be mainly seniors. However, school's off that day. So there's going to be families coming too. And for end of life doulas they're like me. For any of you wondering what is an end of life doula? What are we talking about? Well, an end of life doula is a non-medical support person who is typically, if they go to the right school, It's an unregulated industry, so there are 0 accredited schools, but they go to the right school. They get training on different life transition elements. And it's an area where you can pick a niche or do the whole spectrum. So because I have a registered nursing background, you do not have to have a healthcare background in order to be an end-of-life doula. But because I have my background, I'm taking the full spectrum, not including birth. So I'm not a birth doula. But if you're 18, come see me. I can help you with a living will. And if you're 18 to whatever age and you get a diagnosis that has you kind of stepping back on your heels, come talk to me and let's work through illness navigation to see if we could shore up your natural systems so that it doesn't go further, or maybe we could take you back a few steps to be more healthy. And then I'm also there for the end of life journey. But your traditional death doula, it's a niche. Pick your niche. Some are they're going to be just companions when somebody's dying. Some are companions on the journey to death. Death, when I first told my wife I'm a hospice nurse and my friends, they thought I was going to see people that were actively dying in bed and couldn't have a conversation or do anything. And when I'm coming home and sharing with my wife, I have to work out the schedule. My patient works part-time, and they're like, whoa, what? Well, my wife is like, are you kidding me? Yes, it's 6 months or less, not necessarily deathbed. And that's its own story because in America, a lot of people wait until the last minute. It is a very hard decision to make. I'm not saying that to dismiss that they're waiting to the last minute. It's a very difficult decision. But the catch 22, there every time you act or don't act, if you don't act, that's a decision in and of itself. There are consequences. Studies have shown that if you start hospice service as close to the 6 month mark as possible. And sometimes that's hard because you get a diagnosis, the doctor tells you 2 weeks, you didn't have a chance to get on earlier. But if you get on 6 months, studies are out there showing that you can live an extra 20 to 30 days with hospice support because we're not out there pushing you out the door. We're not out there medicating you to drug you up and have you sleeping all the time. Those are common myths about hospice. So getting back to end of life doulas, some of them will be companions. Some of them, I just want to do advanced care directives. Advanced care directives. That's your living will, your power of attorney, looking at the complete picture when you can't speak for yourselves. Some of them will do illness navigation. Everybody's different out there. That's why you want a curious mind ask questions and explore. But because I went to the healthcare on Friday, September 12th, and I gave my business card to everyone there, and I was so thankful I had extra cards with me. I had a backup set. I normally only had like 12 in my pocket, and there were 13 people there, so it's like I had some extra in my wallet. So I got invited to this, and for those watching, you already know, but for anyone new, I am autistic. I'm at the higher end of the spectrum. That doesn't make me special. It's not like, ooh, higher end. That's actually a good thing. It has consequences itself. But I am autistic. I am an introvert, Myers-Briggs INFJ. And I'm also a highly sensitive person, HSP, which that basically means that empathy comes to me extremely easy, which has consequences. Um, so I can generally connect with people on a very deep level in extremely short time. And again, there's good to that in this field, but it's also bad. Part of the reason why I stress resilience, because without resilience, the HSP has a lot of issues. But so here I'm talking to my wife. Um, she's not a she's my moral support for this business, and I shared that I need to apply the lessons from the Free Will Clinic. Those of you watching this channel on August 18th, I participated in a clinic where they had more than a half, I think it was like 6, 7, 8 lawyers that were doing last will and testament. They did 33 of them. There were several. It took anywhere from a half hour to 2 hours per person. And looking at how this is estate planning. And I talked to the majority of the lawyers who said they're going to send people my way to talk about living wills. And talking about community engagement, the date of this filming is Tuesday, September 16th, 2025. This is going to be published on YouTube next week. So if you're seeing this, we're talking about the past, although this event here, as you see, I'm going to be publishing the YouTube event before this event. But today I went to a business breakfast. And because I went to that, I've been going to that business breakfast the third Tuesday of every month. After several months of consistently going, I've been invited to speak on October 21st about End of Life Doula and integrating with breast cancer awareness. So part of the reason I'm sharing this is not look at me, because I'm the introvert, I'm the scaredy cat, I'm the one that's actually driven up to places and had a panic attack and had to run away. And I don't say that with any pride. I share that with shame that I'm a broken person and I'm being transparent with you. But for here, by getting out there in the community, it's becoming more comfortable that I'm not running away. I'm walking too. Not saying I don't have my moments. I had my moment last Friday when I went to that healthcare friend event, and like I found the last parking space, and it's like, is it going to be that crowded? But I'm glad I went in. So here, in terms of lesson learned from the Free Will Clinic, is I had a table runner. And I'll put in the description below not only where I got my table running. It's under $40, including shipping and handling. I said to my wife, I need to order a replacement. The original table runner, which I can't show you now, mainly because my wife typically helps with those events. Let me just see that my computer monitor is blocking a portion of the screen. So she typically helps with those events in terms of like walking it into the room. I don't have 4 or 6 hands. Um, it is 24 inches wide and 72 inches long, and it's broken down into 30 inches for the hanging front. So that's what goes when people are approaching the table. 30 inches for the tabletop. So if they're talking to you, that's what they look down on. And then they have the back section, which people don't see. And so I ordered a different one today, $39. And it's like, wow, I was so impressed. The colors were on, everything fit. But the lesson learned from last time was on the hanging front, I had my contact information. That had benefits, but nobody coming up to the table knew what I did. Again, not a huge issue because I'm there to explain what I do. But I'd rather them walk up having a little bit more. And then I had some people not even walk up. They were like looking, and you can kind of tell wheels going. I wonder what they do. So I wanted to make very clear what I did. And in a moment, I'm going to switch over to the design in Canva that I used, and I'll take you over to the Amazon site. But um, I decided on the hanging front, let me list my services. And I'm also going to show you too, I ended up making a new design for my business card. So, which I also ordered for that. So this is the old design. There we go, focus. And notice there's no website listed. And then on the back, the QR code will go to the website. But one of the lessons that I learned for this is the back is still very busy. And when people go hospice and palliative care education, there was like a pause, and legacy projects a pause. And again, I could, if they're in front of you, I can go over what all that means. But a lot of times when you're handing out your cards, they take it, look at it a little bit, put it in their pocket, and they go, and it's not until they get back home. I want it to be clear and cut and dry. So I ended up saying, okay, I'm going to just do advanced care planning. I'm going to, in fact, I'll show you through. Let me walk you over. Um, go here. So Let me just go back to Canva just really quick. Let me just show you the card. And so I have advanced care planning, end of life support. That covers the spectrum of hospice and palliative care, along with vigils, legacy projects, um, and so on. Grief support, which wasn't even listed before, illness navigation, and staff development. But in terms of the table runner, here, this is going to be what people see if they're in front of me and they were to look down. So the logo, as big as I can get it to make without going too far. And then just some words just to clarify. We're talking about navigating people through various life transitions as it relates to their health. And again, even though they're going to be in Madison County, I just like that there that they could also see that I'm virtual as well. And then we go to the hanging front, and this is where I solved a couple issues. I have my contact information, and then I have the services. And let me just move that down. And with the services, I go into a little tidbit for the services. Now, this is the PDF version. I put a description on here, but then when you actually order this in terms of customizing it, you need to do your top and your bottom separately. If you order this, so that you're aware, when you go and I really appreciate Canva. I don't have affiliate links, etc. When you download this, you want to take this slider and make it max. You want to take the slider and make it max and then do your download. PNG, slider size max, and then do your download. And then in terms of Amazon, and please don't laugh at me over the outfit choices that I'm looking at, but here's when you go in, $39, and you get to upload the PNG files for the top, the front, and then you give it a link. Part of the reason that I did this over here is you could do a share and you can give it a public link, and it's a view only link. And you can do a checkbox that's only available if you have the pro version, that when somebody accesses that. And so I gave that link in the order along with my telephone number, call me if you have any questions. And by the way, for those of you who may laugh, I do not know if I'm going to go down this route for several reasons. One, I'm the geeky nerd who has never been in shape in my entire life. So I might look very foolish if I was in this outfit. Uh, I definitely don't have the six-pack abs, and granted, that's over. And I don't know if I'd want to wear a toga because I'd be I'm like the old-fashioned guy from the 16th, 17th century in terms of modesty. So even though I tease some of my patients who say you can't be a nurse because you're not wearing a skirt, it's like I tease them about wearing a kilt, I actually don't know if I'd have the guts to go through with it. So I did not order this yet. I'm still working through that. But getting back to where's the preview. So I want to encourage you as we come to the landing zone for this. If you are an end of life doula, or maybe you don't call yourself an end of life doula. For example, and I don't know if this would fit for Jamie Haberman. Jamie, if you're watching this video, hi. I platonically love you. I appreciate you, and I promote your services. Jamie Haberman is the owner of Hospice Buddy. Hospice Buddy is, from my perspective, she doesn't call herself an end of life doula, but she's a RN concierge service business focused in the end of life space, specifically those who have hospice. But technically, she may not call herself a doula, but she is in many ways. But I encourage everyone, if you're out there and you're wondering, like, how do I get clients and how do I build business and how do I build name recognition so I'm getting referrals, go out there. Had I not gone to the health fair, had I not gone out to the health fair and being non-discriminatory, being completely inclusive. I didn't skip a single table. I didn't skip a single table. I went up to the YMCA. I went up to, oh my word, where is it? I went up to the senior care center where they're giving me their literature. I went up to every table and I let them talk to me about what they do. And then I shared what I can do. And some of them asked exploratory questions, which was a wonderful thing. And then you follow up. Like yesterday, I was following up with the elder law attorney that said, would I be interested in meeting with a group of healthcare professionals that work with loved ones with dementia? Yes. Would I be interested in various senior fairs and activities? Yes. Get out there in the community. And if I, who am broken, if I, who am autistic, introverted, a scaredy cat, if I can get out there and do it, what's your excuse? And I'm not saying that to pick on you and judge you. This is a non-judgmental channel. I'm just saying that if somebody like me can go out and make fun of myself and laugh and say, I don't know if I can do this, but I'm going to take a step forward, you can too. You can too. And where I'm going to end, we're almost there. We're almost there. I really appreciate Crystal, who has, she's part of the End of Life Doula Collective in Virginia. And Crystal, I've seen two different last names for you, so I'm not sure which one to use, but she's an amazing individual. So two things out of that: fellow End of Life doulas, if you're watching this, collaborate with your fellow End of Life doulas, even if they're in the same geographic area. It's collaboration, not competition. So I've talked to Crystal via Zoom. She's one of the board of director members, one of the founding members, directors for the Virginia End of Life Doula Collective. And so I was asking her group questions about death over drafts, death over dinner, death over whatever. Some of these venues are licensed, where you have to pay a licensing fee, you have to register as a speaker, and there are limitations, including for some of them that you might be able to hand out your card or not, but you can't say come see me. And so I wanted to know how other end of life doulas, like, how are you doing this? Because I met with a potential client the other week, and they have a studio that is a combination bar, restaurant. It is unbelievably cozy without being too cozy, because it's like really spread out, but not too much, if that makes sense. Like they have couches here and there so people can gather at various couches. They have tables and so many. It is just beyond, the ambiance is like amazing. Pictures and photographs, all appropriate with a mild sense of humor, not too far right, not too far left. It was like I couldn't have asked for a perfect setting. And I'm thinking to myself, if I were ever to do a death over a drink, adult beverage, not that you have to drink anything alcoholic, event, that would be a wonderful place to have it. And so I'm asking, like, how do you work around some of the licensing issues without causing issues? And so Crystal gave some wonderful, wonderful advice. And let me just switch. Oops, I have to go all the way back here. I know I'm running a wrong one. I was doing some word changes. Let me go into planning. Let me go into here. I appreciate when it comes, things work. So we're almost at the end, so please bear with me. By the way, this is in Notion.so. I use Notion.so, both like a wiki database. I have databases. This is not a database right here. This is a wiki site, but it is what you make out of it. And I do it to try to make, like, if I want to remember, I don't just save the post on Facebook, but because Facebook doesn't have a lot of search features in terms of like finding, like I have like, oh, how much saved. So here I can come over, I'm like doing death over whatever. And before I go too far, for some of my viewers, what are you talking about, Peter? Death over drafts, death over dinner. What does that mean? You're killing people here? No. But what it means is that you bring a group of people together, often complete strangers, the public. You bring a group together over an event, dinner, dessert, sweets, breakfast, whatever. And then give me one moment, you might be using products like the Death Deck. And the Death Deck is a whole bunch of look like playing cards. And then they have questions. I'm going to wait for it to focus. Sooner than later, I hope. Oh, my word. Okay. So let me just read off. Which of these eco-friendly burial options would you consider for your remains? A, recomposition, aquamation, or green burial? Or, if I may, while you're on vacation, someone close to you dies. You, colon, A, want to know immediately. B, would rather not know until you get back from vacation. Or C, whatever the people back home decide is fine with me. So these questions are very, some of them are humorous, some of them are not. And they're broken up into different categories. I found it fitting that when I did the free will clinic on August 18th, it had, I shuffled the deck. I mean, I don't believe in luck or fate, but it was like, wow, regarding your important documents, parenthetical, will, comma, life insurance, comma, health directives, ending parenthetical, colon, A, my family knows exactly where to find them. By the way, that's beyond critical. Oh my word! My wife and I personally went through this where we actually forgot that there was living wills for a very close family member. It did cause problems. B, they're filed together and should be easy to find. Best case, by the way. C, they may or may not exist, so good luck finding them. So you could use that or come up with your very own uh, items. And so that's the death deck. I'll put in a link in the description below. So you have that or conversation starters of your own, and then you just go around. Maybe you have a talking stick where you take like a roll like this and put like a sticky or like a stuffed whatever attached, and you pass around the talking stick. Whoever has the stick talks. You may have them on a timer, you come up with different rules, and they go around sharing. Either they're sharing, like, tell me about the time you had somebody die that was close to you, or tell me about this or that. And so you have that event over breakfast, lunch, dinner, sweets, whatever. And so, Crystal said that she's had very guided discussions, coffee shop, call it morning coffee. Winery, call it grapes and graves. Crystal's so creative. Brewery, death over drafts. Get the point. Um, she mentioned she did sign up over with Dress Over Drafts just to get some of the stuff. Um, Best times are evenings and weekends, by the way. In some areas, avoid Wednesday evenings for Wednesday church. Then Jennifer, another person, wrote back. I really like this too. And as I share this, I will never tell anybody to drink or not drink. I believe in moderation. For me, if you were to buy me, say, I hear Peter as a gift for a bottle of one, we're talking about like a 1 liter bottle, that would probably last me anywhere from 3 months to a year or longer. But I like having events where you might get people to be more laid back and relaxed because this should not, even though I tend to be very serious in certain venues and platforms, death, like for me, I want an Irish funeral. And you might say, Abraham, my birth name's McLaren, which so I want an Irish funeral. I want people to celebrate my life and laugh and poke fun at me and roast me or whatever. I want them to enjoy versus sob, 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 oh, we're whatever. That's me. So, but I like Jennifer creating final draft and local bureau. Oh my word, bureau. I'm not going to give up trying to pronounce that. But they receive a sample flight. I'm not sure. I'd have to look up what that word means, but I guess that's like she has it in here. 3 samples of drinks over a 2-hour session. So many seats in price to include the sample flight food trays, and then if the brewery shuttle, I still can't pronounce the word, but the shuttle to make people sure they get home safely. So, but this is part of networking. This is part of getting out there. This is part of educating, because we do need to educate. We're in the final few minutes, almost there. So today's breakfast, Sandy Adams, I really appreciate you. At Just Love Coffee, had everybody go around and give their names, what they work for, a brief sentence, what they do. She did something different this Tuesday. She said, I want you to share a project that you're working on this month. And I want to share this with you because it's very important. I shared that when you look at America at large, now, to be very transparent, I said less than 50% out there. I should have said less than 40% because that's the actual statistic, is less than 40% have a living will in the United States of America. And in the state of Kentucky, less than 9% have a living will. Less than 9% have a living will. If you're watching this video, whether you're a hospice professional, a palliative care, a holistic nurse, a family caregiver, a friend, an end of life doula, it is so critically important to have an up-to-date living will that you're a power of attorney and everybody knows where all the documents are. You don't know if you're going to be in a situation where you cannot make your decisions known. And it's not good enough to have friends and family say, I know this is what they want, because depending on the situation, their voices may be shut off because there's no paperwork. Get a living will done. I do appreciate your time. Thank you so much. Take care.